I'm Dr. Ashoojit Kaur Anand. I'm the Clinical Director at PCMH Restore Health, Sheshadripuram, Bangalore. I'm also the Founder Director of Aviksha, a home-based primary care. My expertise is in HIV, palliative care and geriatric care. Palliative care is where we take care of anyone. The person has an illness which does not have a cure, but can be managed symptomatically. So the symptom coverage is what is a palliative care, where you improve the quality of life of a person and control their symptoms. So most of the people who require palliative care are people who are suffering from cancer and are on chemotherapy or need not be on a chemotherapy, who are not eligible for a chemotherapy, people who are having a renal failure, people with cardiac failure, elderly people who are very elderly, we say 80 plus, do not want to access hospitals and clinics. These people are provided palliative care at their home, and we provide them whatever is required to cover their symptoms so that they do not have to be rushed to a hospital. This also includes end-of-life care. People who are at the terminally ill and probably have a lifespan of a week or 10 days are provided care at the comfort of their home with surrounded by their family members.